Good evening, everyone, and welcome. I'm Jacqueline Bello, Chair of the ACR Board of Chancellors, and it's my pleasure to introduce you to this evening's webinar on our strategic plan. The theme is putting words into action. I'm going to begin with a few housekeeping announcements. First of all, our webinar this evening is being recorded. And to those of you attending, and if you registered but can't make the whole session, you will get an email to the link of the recording. We are hopeful that that'll be available by next Monday. I want to thank the ACR staff, the silent partners behind the screens tonight, both Pam Meckler, who was anything but a silent partner in orchestrating a lot of the strategic planning sessions and collaborations, and Trina, who is available for technical support and has placed her number in the chat should you have any technical difficulties. Again, a warm welcome and a thank you to my colleagues on this evening's panel. I'll be introducing them individually before their brief synopses of the first initiatives in launching the strategic plan. But for now, we'll just briefly thank them for taking the time and being available after their brief synopses for a Q&A session. And for that session, I will ask you to raise your hands in the option that Zoom allows to raise hand. And we will call on you from the participant list in the order that your hand goes up. If for some reason you cannot raise your hand, please type your question in the Q&A, or if you're in a location where you can't speak up, though you can listen, just type your question in the Q&A and we will take those questions as well. Without further ado, because the bulk of this evening is about you, our colleagues in the profession, who we hope will be well served by our strategic plan. Without further ado, I'll begin by introducing Dr. Matt Hawkins. Matt hails from Atlanta, Georgia, and he will be speaking on one of our early initiatives, presenting the ACR as convener of conversations.
Thank you, Dr. Bello, and very happy to be here. Seeing a lot of faces of old friends. It's good to see everybody. Was asked to speak briefly about the Convener of Conversations initiative. I've recently been, I guess not so recently now, but been asked to chair our communications committee. And as we really started to look into all of the ways that our members communicate with each other, how our members communicate with the college, and how the college communicates with its members, it became pretty clear how complex this issue of communication really is. And the way we're being taught and role modeled to communicate, particularly over the last few years, has really led to some increasing opportunities for very divisive communication in a number of different ways, no fault of any individual. At a very basic level, we know that divisive types of communication that makes one person feel like not a member of another group and vice versa. We know that leads to increasing likelihood of unethical treatment towards people of another group. So there's that very basic level where we need to make sure we're doing a great job as radiologists for our profession communicating, because look, our profession's gotten really complex, and we have to have conversations with people that may not see things the same way that we do. We can't just build a wall and send two groups of people into two different sides of it and let them just yell at each other across that barrier. So we need to make sure we can have those conversations with people we disagree with. We need to make sure that we can listen to people that disagree with us. And so we've really taken communication with the objective of inclusiveness, understanding diverse points of view, being able to articulate them effectively, being able to listen to them effectively, and really broken it down into kind of three main buckets of how we communicate with each other as members of the American College of Radiology. Number one is, how do we communicate with each other on our own platform, Engage, that many of you are probably a part of? How can we make that as effective as a community as possible? How can we educate our members to become the best communicators that they possibly can? The other is outside of our own controlled platform. How do we as radiologists and members of the ACR communicate on more publicly available social media networks, whether that's Twitter, Instagram, et cetera. Obviously there we have much less control, but there's ways that we can educate our members, the leadership of the college, how to be most effective and inclusive with our communication on those platforms. And then the third bucket is really how can we as a college interact most effectively back and forth with each other, with our members. We've looked at all this, and there's actually over 100 different ways that the college and members can touch points with each other. And we want to make sure that we're giving all of us, our members, the right information at the right time and having that right conversation when it needs to happen. So that's kind of the overall synopsis of the Convener of Conversations initiative. And obviously, as we move through the night, Jackie, I'm happy to field any questions.
Thank you, Matt. And we'll take questions, I think, at the end, and we'll continue next with Natasha Manga. And Natasha is undertaking the discussion of the ACR as an organization of opportunities. Natasha, the floor is yours.
Thanks so much, Dr. Bello, for the opportunity to speak on this initiative. The aim of the Organization of Opportunity Initiative is to secure our talent within the organization and to amplify our voice to benefit the future. This initiative is rooted in developing future leaders within the organization, ensuring young members have a seat at the table. Currently, the college is in the process of due diligence and assessment of our current state. To date, the initiative team has met with focus groups to understand young members' desires and needs within the organization, finding ways to ensure the ACR is a lifelong career partner. Ultimately, volunteers power the ACR, and matching volunteers' interests with opportunities within the college is a key step in this initiative. The goal is to create a centralized, transparent, user-friendly, and responsive volunteer matching program that matches volunteers across all aspects of the college, including governance, quality and safety, research, economics, and advocacy. Ultimately, the initiative highlights several of the strategic planning initiative objectives, including increasing young member engagement, strengthening multi-directional communication with trust and transparency, as we just heard, and strengthening member sense of purpose and confidence in the future. I look forward to further discussion of this initiative in the Q&A section of the panel tonight. Thanks so much.
And Natasha, thank you. No one with more energy and truly representative of those with the longest runway still ahead. Our money's on you. Next up, Amy, our council speaker, Amy Kotsanis from Rochester, Minnesota. Amy is going to discuss the ACR as the hub of AI and other emerging technologies vis-a-vis advocacy and assessment of these technologies. We will own them. They won't own us. Right, Amy?
Exactly. Thank you, Dr. Bello, for that introduction. And it's an honor to be able to speak about this tonight. I think you're absolutely right. Technology is changing, particularly with AI emerging. Things are not changing as rapidly as Jeffrey Hinton may have suggested. We have not gone over the cliff yet, but now is really the time to take the opportunity to influence AI technology, the development of it, ensuring that it is safe and effective, and really playing to our strengths as an organization with respect to advocacy. Our goal with this initiative is, as with most of our initiatives, are really to empower you, our members, to be leaders in this space, in your hospitals, in your practices, in your communities. We'll do this through creation of an ecosystem of tools, through educational efforts, improving things like our DSI website, making it more accessible based on your experience and knowledge level. We will, as I said, play to our strengths of advocacy and economics, for example, working with the FDA, not only to make sure that applications, AI applications are safe and effective when they're approved, but that they maintain that safety and effectiveness throughout the course of their life as they may be used in your practices. So I think it's a really exciting time with the rapid changing of technology, and that is why the Hub of AI and Emerging Technology is one of our top 3 initiatives in the strategic plan.
Thank you, Amy. And from Dr. Alex Norbash from SunnyCal. Alex is going to walk us through the strategic plan in the day-to-day life of our members. Alex?
Thank you, Dr. Bello. Hello, everyone. So what does strategic planning accomplish? Well, it allows us to optimize our future in a thoughtful way in a window of time that typically spans 3 to 5 years. We understand that central to our role is advocacy and economics. That is what we do. That is our key strength. And we preserve that. And the strategic plan is intended to improve our ability to optimize our functions in advocacy and economics. So there are several considerations when we think about what we're trying to do. We're trying to connect our intent. And again, what is our intent? Our intent is to optimize our communication. Our intent is to utilize technology as well as we can for the benefit of our patients and society. And our intent is also to identify our pool of talent and our future leaders. And this is all allowing us to be better where advocacy and economics are concerned and to excel in every way possible. And there are numerous programs that the ACR has that cross-feed these 3 initiatives. For example, Engage is all about communication. The Data Science Institute is about how do we take technology and utilize it early on to advantage of society and our patients. And how about leadership? Well, the Radiology Leadership Institute as an example. So we reduce the intent to practical programs that can be implemented to allow us to reach our goals. That is the intent of scenario planning. That is the intent of strategic planning. And that's how you utilize it on a daily basis.
Thank you, Alex. We look forward to hearing more from you in the Q&A. And last in the queue is Dr. Thorworth, our CEO of the ACR. And Bill is going to cover the role of staff supporting the implementation of the strategic plan. And Bill, no one better than you as the commander of in chief of that staff. I think Bill is still muted. Can Bill or backroom help?
Got it. My fault. Thanks very much, Dr. Bell. I really appreciate the opportunity to join all of you and to discuss the role of staff. both in the initiatives that have been described and also within the development of the strategic plan. First, the staff really has greatly appreciated the opportunity to participate at multiple phases during the strategic plan development all the way back from day one. And my thanks to them, especially Pam Meckler, who was mentioned, who has kind of led this program throughout. But also our thanks to all of you who have set aside this evening to join us and add your important perspectives. And I hope we will hear an awful lot from you during the question and answer period. The staff perspective is important regarding the understanding of the history of the organization, things that have gone before, the pragmatic achievement of goals, and the longitudinal continuity as we address these initiatives in support of the objectives of the strategic plan. And I'll right out off the bat, please understand, make that distinction between the initiatives that have been described tonight from the objectives within the strategic plan, and encourage all of you to visit our website to see each of those 12 objectives. The staff's been engaged at all levels, but it's been increasingly important in what has been called phase 5, or the strategy execution segment of this strategic plan development, and subsequently phase 6, which is the performance management. So as a result, we made a very conscious decision to restructure our staff dedicated to the strategic plan from what had been previously called the Office of Strategic Planning and Business Excellence, or OSPE, to the Office of Strategic Management and Foresight. And I hope the change is not too subtle, but I really think it emphasizes an ongoing management of our progress in achieving the plan objectives and looking ahead on environmental factors that may prompt an alteration in our course during that 3 to 5 year window that's been described. So each of the 12 objectives within the strategic plan has an executive vice president, or myself as CEO, level champion who will be accountable for the developing key performance indicators and moving the college toward that objective. We're open to suggestions on those, and as I say, please take time to review that on the website. And we want to be sure that the members give us feedback, and you can expect an increased communication with all of you as we address our approach to each of those objectives. Now, the initiatives were actually, following the approval of the strategic plan and the objectives, the initiatives actually came from further work that was done, which focused on short-term, limited, but cross-organizational initiatives that will impact many of the objectives. So fundamentally, these initiatives are designed to move the needle on each of those respective objectives. So approximately 20 initiatives were considered and graphed. These were graphed on the axes of impact and urgency. And using those two axes, the 3 initiatives that you just heard described were selected. And I think we could not be more, accurate in that selection. In that, I think that as the convener of conversations, we heard loud and clear during our environmental research how we needed to have, as Matt described, bi-directional dialogue that is respectful and constructive. I think as far as the organization of opportunity, again, we heard that it was how critical it was to continue to cultivate, particularly our younger members, and afford them the opportunities within the organization. And then thirdly, we know that as Amy said, we're in a time of changing technology, but the college's strength has always been in doing the assessment of technology and then advocating for that technology that is in fact effective. So the initiatives, once designed, each have appointed sponsors within the ACR staff, and these were selected and cross-divisional teams constructed, because again, these are not within a specific silo within the college. And these teams have been working diligently to map their specific initiatives to the strategic plan objectives and designing metrics of success in order to show that they are moving, as I said, moving that needle. So again, short-term cross-organizational efforts on behalf of all of you in order to be sure that we achieve those objectives. So finally, the staff is fully engaged to achieve our overarching goal, and that is to make the ACR indispensable to all eligible members. And for those of you who joined the call tonight that are not yet members, we hope that we can make a convincing argument that the staff and the army of volunteers you've heard about will be working on your behalf. So again, thanks for the opportunity to participate, and I look forward to the discussion.
Thank you, Bill, not only for elucidating the broad input and responsibility undertaken by the staff, but also for the important overview, distinguishing our strategic objectives from these initiatives, which really act as accelerators toward those objectives. So in a nutshell, Dr. Hawkins told us about listening. Dr. Manga stressed the power of our members and the opportunity before them. Dr. Katsanis called us all influencers and said how important it is that we influence the technology, mastering it so that our patients win as we, as a profession, proceed. And Dr. Norbash, the practicality of it being an overarching goal, an overarching practical effort on behalf of our members. And Dr. Thorworth reminded us that this is a living document. So as they say on the public stations, for viewers like you, it's now your turn to give us questions, feedback, and input as we continue to implement, assess, and adjust our strategic path forward. So I am looking in the Q&A and participants. I don't see hands up in participants, but we do have a question from Nina Terry. How does the strategic plan look to increase member involvement, all ages? As groups have become bigger, there's a trend to having a designated ACR member for a group, with others either not members of the ACR, or if the group pays for the membership, members on paper but not involved. We got to fix that. Who would like to jump in?
Alex.
Jackie, I can try briefly if I may. I'm sure that you and Bill can augment this, as can Amy. We have a number of programs and offerings that should be of interest to different individuals within a group. And so, again, our intent is to create programs and offerings that are attractive and are benefits to the members and underwrite the value of the membership. Whether it's the Radiology Leadership Institute or other programs that we have, these are opportunities for individuals to develop their skills, gain abilities, and engage in dialogue with other individuals who help establish policy and strengthen the economic foundation for radiology across the country. And so my sense is that you're right, as the groups become larger, there's more diffuse responsibility, but our intent is to establish the value of the ACR to every single practicing radiologist in the country, every single one.
And I will add to that, that you shouldn't be happy being on a piece of paper. Jump off that piece of paper. Let us hear from you how we can better your practice, your engagement. How can we engage you to make things better for our patients and our profession? And I'm going to put Bill on the spot and ask him to speak to what he likes to call professional insurance. Bill?
Thanks, Jackie. Yeah, I having come from a private practice group that grew from 5 to 18 during the time that I was there, we were a group that was very committed to all the radiologists being members of the ACR. Did that mean that all of the members of the group participated in committees and commissions or in a more organized fashion? No, but did that mean that the group was committed to supporting those in the group that did commit that time, whether it be to step out of the work mode for conference calls or participate in the organization itself? And I don't think this is unique to the ACR. I think that well, in our case, though, we are very different, in my opinion, and many of you have heard me say this, that I never considered my quote dues to the ACR as dues at all. I considered them to be profession insurance. I carried disability insurance in order to be sure that I was adequately covered where I'd have some misfortune. I carried health insurance. The ACR, unlike any other organization in radiology, is in fact looking out for the future of the profession. And I think that it's unfortunate, as implied in the question, that groups would assign a quote ACR designee and then let everyone else be what Dr. Bill Bradley used to call freeloaders, of saying, oh, well, I'm going to get the benefit of the ACR's efforts regardless. So I think that the contribution that can be made by those members of a group that are not specifically interested in getting involved in serving amongst our 2,000, and understand we do have 2,000 volunteers now serving on committees, commissions, task forces, work groups around throughout the college. But if that's not your interest, then you certainly have the opportunity to propel your colleagues forward in supporting them in doing those efforts, because it is in fact working on all of your behalf and making sure that we ensure the future of our respective professions.
I will add that you heard from many of the panelists throughout the description of the initiatives, our continued focus on both advocacy and economics. We are here for you. We are here for the profession, and most importantly, for the profession to do the quality, the right thing for patients. So that is all predicated on a lot of trust. And I would hope that we deserve the public trust. We've certainly earned it with regulators and some legislators, but there's plenty of work to do ahead. We invite all participants. There was another question. It now disappeared, but I'll throw it out there anyway. It was in the chat. Since we talked about advocacy and economics, what is the college's next move on surprise billing? So I'll begin by saying that your leaders have weekly calls as needed with our colleagues in the suit that ACR filed, both from the specialties of anesthesia and emergency medicine. It's been like going to law school. You learn so much about the strategies, and ACR so far has played cards very well. And currently, the pointed question that was typed in was, are we going to be joining the Texas lawsuit and have others? And the short answer is most likely and yes. The thinking being that there was an initial favorable ruling by the judge against the CMS's implementation early on, and that same judge is assigned going forward. So there really is no reason not to file with Texas as far as streamlining our efforts and containing cost as well. Bill, you're on those calls every week. Do you want to add anything before I go on to the next question in the queue?
I'd just emphasize, Jackie, as we have in all of our press releases and other statements about this, that none of these efforts would in any way reverse the patient protection portions of the so-called No Surprises Act. And what we're dealing with is strictly the format of the independent dispute resolution portions of the law and the regulations to implement that law. Be sure that the regulations are concordant with the legislative intent, that multiple factors be considered by any mediator that is involved in that. So again, I think it's been a terrific evidence of cross-specialty coordination and collaboration collaboration. And I think that the entire medical community is mobilized behind getting this right. We were able to get the law written correctly. Now it's important that we get the regulations written correctly.
Alex, were you going to comment? No, okay. Next question is, I'm not sure if this aligns with your initiatives. I'll edit that and say our initiatives. Remember, all input and it's a living document. But has there been any consideration in including nurse practitioners and physician assistants to become ACR members to assist in your advocacy mission? I will point out that our coalition in favorably influencing past decisions on the Medicare physician fee schedule final rule, that coalition has included non-physicians. And for example, the physical therapists came in with, I think, 60,000 strong members signing on to the various letters that really had the positive effect on our bottom line in cutting our losses, to put it bluntly, in the legislation that occurred at the end of the calendar years 2020 and 2021. Does anyone want to make an additional comment specific to membership? So we've collaborated and formed coalitions. Anyone want to comment further on
Jackie,
their membership?
I can comment a little bit further, particularly on the coalition piece. You know, one thing that I never realized till becoming more active in volunteerism in general, particularly when you talk about advocacy efforts, even groups that may not have a lot in common or maybe more publicly adversarial, when it comes to advocacy and battling or promoting legislation or fighting policy that is negatively influencing the medical profession, it's really remarkable how quickly we all become friends and work together really, really well at the federal level. So just for folks who haven't been involved with national policy, national legislation, we work with all medical specialties, all surgical specialties, all levels of healthcare providers, whether they're QHPs, non-QHPs, and our team is the best and does a great job of that.
Thank you, Matt. We clearly have the right person heading up communications. The next question from Heidi Edmondson. Are there opportunities, this is such a good point, are there opportunities to introduce the residents and early career radiologists to the ACR who otherwise missed their opportunity to participate in and attend the ACR annual meetings in 20 and 21?
Be happy to jump in on that question. That's a great question, and I would say that the ACR annual meeting is a great opportunity to start getting involved, but by no means is the only opportunity. There are so many initiatives within the RFS section, medical student section, YPS, whatever your career stage may be, to get involved. So whether that's volunteering in the governance aspect or finding other ways, which is really what this initiative is hoping to do, is expose members across all levels of the college, so even beyond governance. So for example, if your interests are quality and safety, economics, advocacy, finding ways to match your interests with the opportunities in the college. So feel free to reach out to me anytime. I'm happy to discuss opportunities within, whether it's the resident or newly in the YPS section, and find ways to get involved and really just learn more what the scope of ACR activities is at this stage of your career.
Thank you, Natasha. And I would highlight the opportunities for residents in pursuing the various fellowships that ACR offers. from publishing to quality and safety, and others, the economics. And I think that they're wonderful opportunities and very rich in understanding those various aspects of the college. I would also suggest, having been on a chapter visit to Florida, I don't want to insult anybody at the attending level in Florida, but I had a role in the main meeting and then a separate meeting with their resident section. That was my favorite part, I have to say. And so clearly being involved through your chapter is another option. And Florida told me the story. They didn't always have this separate, large, involved group meeting with them at the time of their chapter meeting, but it got started. Again, jump off the paper, whoever you are. And another way of being involved, and I've welcomed the participation, and this is just a selfish plug for Chat with the Chair. Jump in, give us ideas, and tell us how you want to be more involved, and we'll get you connected.
Jackie, if I could add a couple
Please.
additional comments. The first is anyone who missed an opportunity to come in 2020 or 2021 is certainly welcome to attend any annual meeting in the future. And this is where I give the shameless plug for next year's meeting, which is our 100th anniversary meeting. We all have the Zoom backgrounds. So I strongly encourage residents and young physicians to come to a future meeting. The second thing I would like to add is with 2020 and 2021 being virtual, we found that there were people who participated who would not have been able to come even if there had been no COVID, that were able to participate virtually. We had many members that were able to do the same last year, and we will have a virtual option in the coming year. So we are really looking for ways to make our meeting as inclusive as possible, even to those who, for whatever reason, may not be able to travel and participate in person.
Thank you, Amy. The speakers have really gone all out in trying to make that happen. I'll move on to another question in the Q&A. What is our plan to boost promotion and utilization of our well-being efforts? Seems more important now than ever. Absolutely.
Jackie, I'll just jump in to comment that the college, the Board of Chancellors of the college approved several years ago access to the what was called the Wellbeing Index. It's a tool that was initially developed actually at Mayo Clinic by Tate Schoenfeld, and who's now at Stanford, and still support the access to that. So any practice that would want to do a self-assessment of where their members stand with using a nationally recognized tool with metrics for comparison, that's still available to you. So unfortunately, that has not had the uptake that we had anticipated or hoped it would have. And I think that Chad makes a good point that particularly in these days of high volume productivity requirements and burnout, that this is really a more important effort than ever. And particularly as we request of our listeners and others, other volunteers, to potentially commit some additional time toward the college, I think we need to be sure that they're staying healthy while all that's going on. So I do think that, again, the toolkits that have been developed by our Patient and Family Centered Care Commission and our Commission on Publications and Lifelong Learning are available through the website, and would encourage any listeners who are looking to how to implement such a program within their practice. These tools are available to you and ready for use.
And I'll add that as recently as this past week, your leaders have had conversations with the AUR about updating those surveys to be more inclusive of COVID-specific effects on wellness, not only physical, but well-being. So again, reverting to the concept of tools being living documents or changeable implements to keep up with times. I see that Trina put the notice of the next chat with the chair in the chat, as well as the next annual meeting dates. Richard Strax, is there a strategic advantage for ACR in the future to form advocacy alliance with pathologists? I will tell you, Richard, as an AMA veteran, that we regularly meet at the House of Medicine with the caucus that is the hospital-based physicians. And this, of course, includes anesthesia and the emergency medicine folks, as well as the pathologists. So the groundwork is already laid, and there are many policies on which we do advocate together. And so I think in particular, and I don't want to put Amy on the spot, but integrated diagnostics is one of her favorite topics, and she's quite knowledgeable. But in particular, as we merge toward liquid biopsies and a much more molecular and genetic basis for everything we do, I think it makes total sense. Amy, would you weigh in?
Sure. And I was going to raise my hand to do so. Prior to COVID, I was working with the informatics group as well as the economics group and quality and safety to convene a summit that included pathologists. The informatics folks have been in regular communication with similar organizations on the pathology side about where we can collaborate on things related to technology, related to AI diagnostics, for example. And the economics folks talk to them regularly as well about how, as we develop these tools, how might we get paid for when we're utilizing them, what's appropriate utilization of them, et cetera. So there are already a lot of conversations happening between our organization and the large pathology organizations. And I expect that will continue, and we will strengthen that collaboration as many of these technologies evolve.
Yeah, Jackie, I was also going to mention that the large pathology organizations were part of the over 100 medical specialty societies and other organizations in both the 2020 and 2021 efforts to mitigate Medicare physician fee schedule cuts that were going into effect in 21 and 22. So yes, we're working hand in hand with them, particularly on that legislative front as well. Sorry, Alex.
Thank you. But before I ask Alex to weigh in, Bill, did you want to cite for us that back of the envelope calculation, the net result of savings from the end of the year legislative campaign, if you will, by that coalition?
Sure, but in the 2 years, the aggregate impact is somewhere in the range of about $500 million of reclaimed reimbursement that would have been lost had those cuts gone through. So yes, it had a very, very, very substantial impact. And again, that's now it's a projection as applied over 10 years. But so yeah, a very, very positive impact. And sometimes it's tough to convince those with who you represent that it's a quote win if you mitigate cuts. But when the mitigated cuts result in that much preserved revenue, I think it's a pretty easy sell.
Thank you. Alex, you're up.
Yes, I just wanted to compliment to some degree what Amy just stated. So a lot of us are wondering, well, what is the relationship between pathology and radiology in the future? And again, we're thinking about these three camps. We're thinking about communicating in a more effective way, utilizing technology more effectively, and leading. And so when you think about this innovation space, obviously one area is combined radiology pathology reports. And I know that UCLA for a while now has been generating on patients who have new neoplasms combined reports that include pathologic information, genomic information, radiologic information, and the intent is to have all that essential information in one place. So that's a combined report. Another opportunity is something that I saw recently at an AI conference. UC Davis has developed a package where every time a pathologic diagnosis is generated in pathology, a search is done to see if there is any imaging information that is related to that pathologic information. And then what happens is that information is fed back. So when I show up in the morning as a radiologist, I can pull up a list of 15 studies that are studies that I have read, and I can see exactly what the final pathologic diagnosis was on those cases. So now finally, I will be receiving feedback about how often am I right, and how often is there a learning opportunity for me. And so we're going to see this space moving pretty quickly. But again, it's why that technology leadership is so critically important, to understand how to integrate that into our practices. And finally, University of Texas in Austin does not have a separate radiology department and a separate pathology department. It is a unified department of diagnostics that Nick Bryant set up, our friend Nick Bryant. So a lot's going to happen in this space. But again, it keys in on those three major topics that we discussed in terms of how to succeed in the future.
Thank you, Alex. And Alex, you described a pull mechanism that you have available. I am aware, and in full disclosure, I am not at NYU, but I am aware that if I, as a neuroradiologist at NYU, dictate a report on an MRI, without asking, without looking, without pulling up, I get an email. If that patient goes to surgery, I get an email with a path report on that same patient. So it really is, it's here. It's here, the merging of, and it's important that we acknowledge.
Jackie, if I can add one comment to this concept.
Sure.
Several years ago, Dr. Sam Gambier, who was then chair at Stanford in the radiology department and a real visionary, was giving a lecture, and he said, during the lecture, he said, "I'll show you the future radiologist." And his next slide was the integral sign from calculus. And he said, radiologists are going to be the integrators of data. Whether it be imaging data, whether, as Alex said, it's going to be genomic data, the pathology data, that in order for us to equip ourselves, for this, and it's not so far down the line, for this new reality, I think we really need to begin to accept that role and see it as an opportunity for radiologists to be central in the healthcare stream.
Thank you. I don't see any other questions in the Q&A. I don't. Okay, and any of the panelists want to make any additional comments? If not, I'm going to ask Natasha, as an early career member, about the benefits that you see coming from the initiative ACR as the organization of opportunity. I know that you would not have put yourself out there and said to the trainees on the phone or the young physicians on the webinar, please reach out to me if you want to know more ways to be involved. So I know you wouldn't have offered if you didn't perceive a benefit. And for those who don't know, Natasha was at the strategic planning table, taking time away from that important part of her career. Thank you, Natasha.
So, I mean, going through the RFS process and now into the YPS process, I've had the opportunity to meet with young radiologists, young trainees across the spectrum. And what I've come to learn is that we are very talented and very knowledgeable. And matching those interests within opportunities in the college is a unique challenge. And so I think by organizing the opportunity, our young members will have a way to further develop their understanding of the scope of ACR activities, and really cultivate their talent within the organization. And I think in turn, the college will have the opportunity to secure this talent early and build upon the relationship throughout radiologist careers, and that will really help through career transitions as well. And so through these new organizational methods, I think we have a real opportunity to not only expose our young members to the opportunities, but match their interests and develop them as they go.
Thank you, Natasha. And I'll speak from experience just doing the chats that we've had 2 people interested at the resident level in returning to a subsequent chat. And I've had residents reach out, remembering being involved in a chat and wanting further information. So I really think that the message is going back to Dr. Hawkins, stressing listening as part of communication, that it's only from listening do you generate more engagement and more active, present communication. So thank you.
Jackie, I'd be remiss if I didn't mention a major infrastructure change that's facilitating the first 2 of the initiatives, that is convener of conversation as well as organization of opportunity, and that is the implementation of our new association management system, which is a nimble Salesforce platform. I know some of you may have struggled with the changes over the last several weeks. I actually just pulled up my profile and found out that I was a non-member, so I know there's still a couple of hurdles yet to overcome. But the once completely functional, this will allow us to identify and customize the interaction with not just our young members, but members across the board, understand their desires, wants, and needs, and better match them, better communicate with them, and better match them with opportunities that exist within the college.
Thank you, Bill. And I guess you're proving the point that we do have quote unquote non-members participating tonight. But back to lessons learned, we heard loud and clear from a prior town hall that many of our members had turned off emails from ACR because they were being inundated. And so this will allow us to tailor communications, and members can filter what communications they'd like to get. The point being, when we issued a survey, many members complained. This is how we found out about the turnoff. I didn't get a survey. Well, if you have all emails from ACR turned off, you didn't get the survey. And I think that we were able to send the survey to those folks ultimately. So I do believe that this new platform will improve communication in a big way. I'm hopeful. Any other questions? There is one. Okay, Heidi, is it possible to add new volunteers to committee assignments outside of the annual cycle that takes place in the spring? Engaging eager volunteers at the time of interest would be helpful. I will personally say, having chaired quality and safety in the past, that we are always willing to put folks to work and pave the way to becoming a committee member, but getting your feet wet well in advance. So I would be hopeful that the answer is more uniformly yes than no, especially at a time that we are doing our strategic plan. Okay, from a staff perspective, we have a input for you as well, Heidi. Please.
Thank you, Dr. Bello. This is Trina Bebahani, and I'm Senior Director of Governance and Member Engagement. And what you're asking, Dr. Edmondson, is exactly the direction that we're heading in with respect to being an organization of opportunity. And so we understand that not all opportunities to engage with the college come through a commission or a committee in an annual cycle. And so the work that we're doing is to identify all of the various opportunities and to understand that we need volunteers at various times throughout the year, and it may be for a one-time engagement or a 3-month engagement, something that we come back to. And we've had a couple of opportunities here recently that have been what we call micro engagement opportunities. So it certainly is our intent to continue moving in that direction so that we can fully engage members that have an interest in working with the organization.
And I'll add that one of the follow-ups from Chat with the Chair is a conversation planned for next week with a resident about just that. So in action, or as Alex Norbash would say, news you can use, right, Alex? The practical aspects of our strategic plan.
Yes, Dr. Bello.
Okay, we have another. That is the same question, and there's nothing more in the chat. Okay. Folks, we have 4 minutes if anyone wants to chime in. And if not, I'll begin with my thank yous, but feel free. We have time for another question if anyone would like. I do, though, want to acknowledge the hard work of Pam Meckler, as Bill noted, along and throughout this whole process. I want to acknowledge the work of our co-chairs, Alex Norbash and Frank Lexa, for really engineering a lot of the discussion that led to the formal facilitation of the plan by an external consultant. And I want to thank Trina for the support she has given this and the college in as long as I can remember. Although I do think I was there first, Trina. I want to thank the panelists, our non-member, Bill Thorworth, our longest runway member, Natasha Manga, our council speaker, Amy Kotsanis, and our great communicator, Matt Hawkins. It's because of people like you that we can do what we're doing, and more importantly, in my opinion, do it well. And if not, let us hear from you, please. So with that, I will thank you all again. I am looking in case there's any last question. My panelists are not off the hook yet. Okay. Then you have 3 minutes back of your time. And please, to quote Bill Thorworth's usual, stay well. Did I get it right, Bill? Let us hear from you. Thank you all again, and good night.